Hey everyone. So, we have mentioned nosocomial infections in lab in some of the organisms we're talking about. Do you remember what they are? They are infections that a patient acquires in the hospital. They go to the hospital with one complaint, and while they're there, they pick up something else. Nosocomial infections, that's kind of an older term, although I think your textbook still uses it. More commonly now, they're called hospital acquired infections, and they affect 5 to 15% of all hospital patients. So this is a big deal, not only economically, but health wise for people. A lot of healthcare associated infections result from this kind of perfect storm of these three different qualities that we see. One is that there's lots of microbes in a hospital environment. So if there is someone who is sick with something that is rare, probably they're going to end up in the hospital. And so all of those microbes just all converge in one area. Another is that there are lots of hosts that are weakened. They are sick with something. They are recovering from surgery. They are, for some, whatever has brought them to the hospital. It's probably something that has weakened their body and maybe weakened their immune system. And one is a chain of transmission. So you have the same doctors and residents rounding on all the patients, the same cafeteria worker bringing breakfast to everyone, the same elevator buttons, and the same airflow going to all the rooms. So we'll talk about microbes on the next slide. But when we talk about a compromised host, so someone's resistance to infection is going to be impaired just by being sick, by undergoing therapy, or by being burned. They likely have broken skin or mucous membranes, which gives an easy way into the body for infections. They may have suppressed immune system from their T and B cells being impacted by therapy. And then transmission would involve both direct contact between staff and patients, or between patients with each other as they're walking around the hallway, and indirect contact through fomites like those elevator buttons or, the hospital breakfast cart and the ventilation system blowing the same air through everyone. Microbes that we see in hospital acquired infections, we have coagulase negative staphylococci. So these are types of staphylococci that are involved in about a quarter of nosocomial infections. Staph aureus, one we've talked about a lot. Enterococcus. Gram-negative rods, just a generic group of gram-negative rods. A lot of these are enteric bacteria that grow in their intestines. And then C. diff. If you have any experience with C. diff, I would love to hear in the discussion board today where you talk about that. This is one that, if you've dealt with it, you definitely know it's pretty gross. Okay, so those are some of the more likely causes of nosocomial infections. A lot of these are causing urinary tract infections, which is not surprising since a lot of people in a hospital setting are on a catheter, which just the catheter itself is easily contaminated, but also that provides some kind of wound-ish area from the catheter being taken in or out. Surgical site infections, so where that skin is broken. Lower respiratory infections in their lungs where people are breathing in. Bacteremia, a lot of that from IV usage. Cutaneous infections, so within their skin, and then just other stuff. To prevent healthcare associated infections, there are universal precautions. This would include the standard basic minimum practices, like you will probably be told to put on gloves, to wash your hands. You may be told to keep your nails trimmed. There are also transmission-based precautions that are a little bit extra, and those transmission-based precautions are going to be based on when you have something that's easily spread or you suspect you have something, just however that's spread, you're going to try to stop its spread. So this might involve contact precautions like putting on a face mask, droplet precautions, or even airborne precautions where you maintain negative airflow or positive airflow to control where dust and microbes are able to spread. This involves reducing the number of pathogens, such as washing your hands. Always you should be washing your hands when you go, when you come into a new patient room and when you go out of a patient room. And you have every right to expect a healthcare provider to wash their hands before they touch you to tell them, I need to see you wash your hands before you touch me. Also, when patients are bathed, those tubs that they're bathed in should be disinfected. Medical instruments should be cleaned. So if you are using a stethoscope, you need to wash it between patients. You can't just go stick it on one person's back and then touch the next person's skin after that. And then using disposable bandages and disposable intubation. So if you are wrapping someone's broken leg up, you don't need to try to reuse that. If you are intubating a patient, use disposable as much as you can. I am very pro environment. I usually hate disposable or single-use items, but when it comes to healthcare, disposable is absolutely okay. And then most locations, most organizations will have an infection control committee that will actually study how are we doing, what are the numbers, what is spreading around, how can we do this better. They may put up a sign that says employees are required to wash their hands, or other, reminders and policies to help limit the spread of healthcare associated infections. So you can tell me what interacting factors result in a nosocomial infection, what is a compromised host, and how are nosocomial infections primarily transmitted, and how can they be prevented. All right, I'll see you back. We have one more lecture for this chapter. See you later. Bye.